Thank you very much indeed. But can we talk about migraines now? Because they can absolutely dominate your life if you're not careful. I wonder if you are a sufferer of migraines. What steps have you taken to try to get them under control? Have you ever thought of trying Botox? You know, the stuff that they inject into your skin to get rid of the wrinkles, to make you look all young and gorgeous. Well, a clinic on the borders of Essex and London is using Botox on migraine sufferers, apparently with excellent results. Dr. Vivek Mehta is consultant in pain medicine at Hollyhouse Hospital, joins me now. Vivek, good morning.
Good morning, Dave.
What is a migraine to start with? Can you try and define it for me?
Migraine is a form of headache, Dave. It can happen on one side of the head or both sides of the head. And patients usually range from children from 12 years of age right up to elderly. And the patients will present with a throbbing pain. And this, most importantly, will affect their activities of daily living. They might have unusual sensitivity to the light. They might feel sick. They might have nausea, vomiting. But the key thing to understand in migraine is that it is a fully reversible phenomenon. So once the attack has gone off, they're absolutely normal, like you and me.
And do we know what causes one with some people? And I've never had a migraine in my life. I never want one. Are some people more susceptible than others?
Well, there are 8 million people actually in UK from rough estimates who suffer from migraine. Wow. And we were looking at the data from the number of attacks. It's just less than 200,000 attacks a day. So, a lot of people actually suffer from migraine. And if you look at why this happens, it is perhaps related to the hypersensitivity of the nervous cells. And what happens is that these nervous cells become hypersensitive, and once they become hypersensitive, they are supplying to the blood vessels, which would create this throbbing sensation that patients have with the headaches.
Right. Why Botox? How does that work?
It's very interesting, actually. If you look at Botox, it is possibly the most toxic substance that human knows.
Because it's botulism, isn't it?
It is botulism, and in 18th century, that is how this disease was so prevalent in our country. And it was not till 1875 when we actually identified this little culprit called botulinum toxin. Now, this is what we do is in a very, 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 very tiny dose that is injected. And what essentially it does is, and it's all hypothetical when we say, what it essentially does is, it would block the transmission from one nervous cell to the other nervous cell. So if you imagine there are loads of nervous cells in the body, and they are conducting little impulses by touching to each other.
Yeah.
What is happening is that the Botox is inhibiting or decreasing the transmission of one nervous cell to the other cell. And if you look at why migraine happens, once this transmission is decreased or inhibited, the blood vessels will not contract that much, and the symptoms are better.
So does it work long term, or does it work just to sort of get rid of the current attack, or what?
It should not actually be used for getting rid of current attack. It is not recommended, and this is what the NICE guidelines, which came up last year, September 2012, were very, very categorical. It is not there to for an acute attack treatment.
So is it long-term relief?
It is mainly for prophylaxis, which is the long-term attack relief.
How long does it last?
Roughly, and the data that is coming from the trials and the research, it's about 12 weeks. So the patients have a set of injections every 12 weeks.
Can you get it on the NHS?
Oh, yes. The NICE guidelines came up in September 2012. The FDA and MHRA came a couple of years ago, and it is available in National Health. But I'm afraid the problem is there are very, very few specialist headache centre. We do this in National Health at Bath in London.
Right. So you can go to your doctor and say, I want to try Botox for my migraines.
Yes, if the patient, and as per the NICE criteria, what happens is if you have if you have migraine, what you do is you go to a doctor, and your doctor should refer to a specialist person, either a pain physician or a neurologist, and they should try simple things first. And the simple things are, for example, trying paracetamol, trying things like over-the-counter Nurofen, stronger like amitriptyline. And once you have tried all these things and they haven't helped, then the next course is Botox. And there are specific indications for it.
And have you got some examples? You've obviously had results from this. What sort of results have you had?
I mean, we have been doing this treatment since NICE gave us go-ahead last year.
Yeah.
We have done this in Holly House for non-NHS patients and both NHS patients at Bath and London. And the results have been pretty good, pretty phenomenal. I mean, we have had few patients who have said that the migraine has reduced by 90%, or they have not had the attack that they normally used to have.
Wow, Vivek, thank you very much indeed. Dr. Vivek Mehta there, consultant in pain medicine at Holly House Hospital. So over to you. Have you suffered from migraines over the years? And I wonder, since this came in last year, whether you have tried Botox. Has it worked?